No, this is the scope. Where is the scope right now? Does anyone know what structure it's in?
In the duodenum?
Mm-hmm. It's in the duodenum. Yep. So the patient swallows the tube, the scope. It goes through the esophagus, through the stomach, into the duodenum. And then it injects dye through the papilla. And the dye travels through all the ducts. And it's used a lot to find stones in any of the ducts. And it can also, they also can go in through the scope and remove the stones. So they can actually use this as a treatment procedure as well. It's also used in surgery during cholecystectomy to make sure that when they cut the gallbladder out that they're cutting the cystic duct instead of the common bile duct, because then it's a little big problem for the patient. So they have to make sure they cut the right one. And everyone has a different anatomy in this part, so the cystic duct looks different on everybody, so that's what they use this for a lot. Any questions about ERCP? Okay. Next is an abdominal CT. For the abdominal CT, don't forget that you're looking from the patient's feet up, so make sure you know what's right and what's left. With a CT like this, you can't scroll through, so it's hard to see what some things are, but unless it's super obvious, it's not going to be a test question for you. So, for example, this right here is what?
The liver?
Mm-hmm. That's the liver. And this right here.
Gallbladder?
Mm-hmm. That's the gallbladder. This right here.
Aorta?
Mm-hmm. The abdominal aorta. And that's right here.
Pancreas?
Mm-hmm.
The kidney?
Not the kidney. Not the stomach. You're lower than the stomach.
Spleen.
The spleen, yes. It's just really large, so it may have thrown you guys off, but it is a spleen. You can see some of the vessels here. This is part of the small intestine right here. And then you got this guy right here. Which is what? It's filled with contrast.
Kidney?
No, we're too high for the kidneys. Because don't forget, this is a huge chunk of liver, so we gotta be higher up by the liver. It's next to the spleen and the pancreas.
Stomach?
Nope, we're lower than the stomach.
The splenic flexure?
It's the splenic flexure. Yep, that's the splenic flexure, which leads into the descending colon. Any questions about this one?
Are they always going to be at that level? An abdominal CT? Like, how would you know?
Oh, no, it could be at any level.
Okay, so we would have to be told that we're at the level that's going to be below the stomach.
He's not going to tell you what level you're at. You're going to have to figure it out by what organs you can see.
Okay.
If you can see the spleen, you're usually too low. Well, the spleen's large, so it's probably not. But you're by the pancreas. You're not going to be able to see the stomach if you're by the pancreas.
Okay.
Any other questions? Yeah, you're going to have to figure out what level you're by. Alright, so this is a little bit lower, and the reason I know we're lower is because I can see this structure right here, which is what?
The duodenum?
What does it look like?
Kidney.
Yeah, it's a kidney. This is a kidney. You can see some of the vessels leaving the kidney. What's this?
The transverse colon?
Mm-hmm. What's this? Someone take a guess.
Duodenum?
No, you're lower than the duodenum. You're already
Oh,
at the
right.
sigmoid.
Sigmoid?
Almost the same color as its buddy on the other side.
Isn't it a kidney?
It's,
Mm-hmm.
It's higher than the other one.
Exactly. Don't forget the kidneys are at 2 different levels.
Oh, yeah.
So is this higher or lower?
It's lower.
Higher.
Okay, so this is the bottom of the left kidney, and this is the right kidney. Yes. You got some small intestine going on here. You have this right here. Don't forget to say abdominal aorta, yeah. And then you got this guy right here. And one on the other side as well.
So this is major.
So is major, yep. Muscle, don't forget to say that. Any questions about this one? Okay. Sorry, this is another KUB, just showing you where you are on the CT. So this is the corresponding CT. It's at a different level, a different view. So you can see different things than you could on the transverse slices. This is a vertical slice. So you can see this structure right here. The liver, yep, not this one. This right here. Yep, and you can see some of the vessels. This right here is the aorta. Yeah.
Kidney.
You got this right here.
So is major.
So is major, yep. What about this one?
Iliacus.
Any questions about this one? Yeah. This is an L spine, so it's an X-ray of the lumbar spine. You have 2 different views, frontal view or AP view, and this is a lateral view. On here you can only see the bones, so you can see the vertebral bodies, you could see the intervertebral spaces, you can see transverse processes on both, you can see spinous processes. Don't forget the sacroiliac or iliosacral joint. You can see the sacrum on both views. Make sure you know what level you're at. So it's really hard to find L1. It's a lot easier to find L5 and work backwards. So make sure you can always locate L5. So for example, this is L5 because this is the sacrum. So make sure you can locate L5 on all the models. Any questions about the L? It's pretty straightforward, the L spine. Any questions about it? Okay. Next, we're going to look at a lumbar MRI. So this is just an MRI of the L spine. You have, on MRI, you can see soft tissue structures. So, for example, you got some back muscles over here, but don't worry, you can't tell what they are without scrolling through, so it won't be a question. You can see the vertebral bodies again. This is the sacrum. You got all the vertebral bodies. You got the intervertebral discs. You can see possibly some transverse processes. We don't know for sure, so don't worry about that. You can see some spinous processes here. And does anyone know what this is? The same thing over here.
The spinal.
Or what's it called? I don't even know anymore.
Spinal cord?
There you go.
It's the spinal cord. Yep. Yep, it's the spinal cord. And the reason it's white in that picture is because it's surrounded by fluid, which is the CSF. On some MRI images, fluid appears white, and on some MRI images, fluid appears black. It depends on what they want you to see. So they have different types of imaging. You'll learn way more about that in radiology, so don't worry about it now. I'm just trying to show you that it can be either black or white. On your test, it would probably be white, I'm guessing. But who knows, because I don't know what the images look like. And let's see. You got this right here, which is some pathology, so it won't be on your test, but it's cool to see. Does anyone know what it is?
Is that a herniated disc?
It's a herniated disc, yes. And this one's labeled, so, but you got the skin and the back muscles. You can see some spinous processes here. You can see the spinal cord again, all the levels, the discs, the sacrum, some spinal stenosis. That's pathology, so don't worry about that. Any questions on MRIs? Any questions on any of the other radiology? Okay, Stacy's going to show you that model.